I'd like to ask our panel members particularly about the temple, and if you'd give us an answer of what product you choose for temple revolumization primarily, or what is your go-to product when the patient comes in with that orbital rim skeletonization, because obviously patients don't come in and say, could you please, treat my skeletal orbital rim, and what plane do you inject? So product and plane would be the question for temple rejuvenation.
So here's my view of the world with the temple. The temple is really easy if you do it properly. In my opinion, I agree with Amy, you want to be right down on bone. I inject pretty much in bolus. I might put a few aliquots around, but you're right down on bone. If you are anywhere more superficial than that, sitting somewhere in the middle ground, there are lots of vessels tracking in and around there, and some interesting reports coming out on that. I think you're asking for a problem. My problem with injecting more superficially, and we've seen injectors at this course treating this way, and some of our own panelists doing it, there are a lot of vessels there, but I've had a lot of patients who've come into my office injected elsewhere superficially, and there are contour irregularities. It's pretty thin skin up here in the temple in a lot of individuals, especially older individuals, so it's just like the tear trough. If you're injecting something superficially, once everything settles down, the contour may not be just perfect. I do lots of temple injections. I go straight down the bone. I use a fairly high G' product like Radius. I think Voluma will be very promising there. So that's just my view of the world.
And how long is your needle?
My needle is usually 3/4 of an inch to an inch minimum.
Okay, thank you. Michael.
I think temples are probably technically the easiest area of the face to inject, as long as you don't make a contour irregularity. I would inject any product there, calcium or HA. If given my first choice, what looks best, I think it's Sculptra, but I don't inject it deeply. I inject it superficially. When I'm injecting Sculptra, I try to scrape right along the undersurface of the dermis because, that's where the fibroblasts are. And I like to try to thicken that dermis. I think you can hide some of the vessels there. And I think the key to reducing embolic phenomena, which is what we're talking about, is really a slow rate of injection. I'm not an aspirator, but then I never inject with my needle in one place. I'm constantly moving the needle, and I inject in a very, very slow rate. So in the 1 in a million chance I cannulate an arterial, I'm out of it in a second without an appreciable amount of product being in there. That's what I'd say.
Okay. I personally like to inject both deep and superficial. I think one concern we have to have when we're teaching our colleagues with deep injections is the needles that come in the package with an HA often are a 1/2 inch needle, and it is very difficult in some patients to get all the way down to that supraperiosteal plane with that short needle. And I think then you're at much greater risk, they're more intramuscularly, to get that deep temporal vessel. That deep temporal artery, I recently did a cadaver dissection in Shanghai and almost fell over when I realized where that deep temporal artery really was, and that how important it is, as we've all discussed on this panel, when doing that deep injection, to really be able to get down to the bone, feel that bone, know where you are. I actually do reflux as well, and then do a bolus injection down. I find that some patients still need a superficial injection if they have a lot of loss. However, with those thin-skinned elderly patients that I have, a few times I have not reconstituted the product, and I was not happy with the irregular contour. So live and learn, and I think that's the exciting thing about a panel like this, where we can really share tips that have helped us. So I'm really a deep and sometimes icing on the cake superficial, but I've appreciated the importance of reconstituting and thinning down that if I'm using an HA or Radius, so that I have a smooth, even contour.